Allison with Kai Massage coming to you today because I've had a few friends and clients and just people in general talking about knee pain and lack of range of motion or mobility for various different reasons. So I'm going to do a little bit of soft tissue demonstration that you can try at home before you do any sort of workout. See if we can reduce some pain, increase some blood flow or circulation to that area, and then hopefully increase some range of motion so that you can start to strengthen and utilize that knee joint. A few things you're going to need. We use rock rub at Kime. So if you have some sort of, this is like beeswax mostly. So if you have some sort of tacky lotion, you don't want anything super oily because we want to be able to grip the skin and kind of get some of that fascial grip. So something like that. If you have a self-myofascial release tool of some sort, we have a rock blade here, but you can use a butter knife on the blunt edge side, or you can use a foam roller or a lacrosse ball or any type of thing. So I'll try to show you some different tricks with that. So get your supplies together and let's try this out. So you're not going to see my head on this because we're working on the knee, so you don't need to see my face. You can see my knee here. I'm going to get a little bit of lotion. Now, if you've got some inflammation going on, the first thing I'm going to show you is how to kind of flush that out. So get a little bit of your lotion, okay, on your fingertips, not too much. And we're just going to pull that tissue towards your body, okay? Now, the big thing with flushing is we want to try to get all the way around. So you got to kind of play with the angles that you can do. And you try to bring all that fluid up towards your heart. So we want our heart and our circulatory system to kind of flush that out along with our lymphatic system. So these are just, excuse me, long, slow, not a ton of deep pressure strokes. We're just gonna kind of encourage our system to work here, okay? Ideally you're in shorts and you can go all the way up the leg, okay? So it doesn't take a lot of lotion. Main thing is I'm working along the surface. So as I go, you can see my skin. So we're working in that fascial layer in between the skin, the fat layer, and the muscle, right? And all the fascia that goes around the muscle. So pretty, what we call superficial, closer to the edge of our skin. We're not getting too deep into the tissues there, okay? You also can use a tool to do that if you feel like it's awkward trying to pull to yourselves. So you're just gonna, same thing, add an angle that you can kind of, not that I am scraping the, just like brushing across the surface, but about a 45-degree angle. And same thing, we're gonna try to grab as much skin and fluid and bring that all up around. Now the knee can be sensitive because it's a bone, right? So we don't want to scrape our bones. So just kind of go up and around the bone and make sure you get all sides of your knee. That's if we've got some inflammation. Now, if you have some pain around the edge of the knee, I'm going to turn here. Okay, so maybe you've got some patellofemoral pain, or your quad is really tight and our quad tendon comes and attaches down here. So we're going to take some of that lotion again and just kind of get in around. So this is the top of my tibia, my shin bone. I'm going to start just north of that where some of the tissue is, and we're just going to spread out towards where our meniscus is, kind of in that knee joint. So I'm pulling the skin up. You can see I'm creating tension here. And then I'm going to drag it laterally or to each outside into the joint there. And then get on the inside of the knee and continue to pull it up. Okay, feels really good. I did this after both of my knee surgeries. And it just, again, it also helps with the fluid dynamics going on in that knee post-surgery. Okay, and then we're gonna go straight up over the patella, so your kneecap and drag it towards you up that quad. Nice long strokes. Using this hand as the tool and this hand as my pressure. So I'm going to press down and use the other hand as my point of contact. All right, the great thing about massage is it gives our body external cues of feeling that sensory feedback, but then we also want to get some internal cues. So as I pull, I'm going to start to bend my knee to try to create some range of motion. So I'm going to straighten and then bend. So not all the way straight, but I'm going to straighten and then bend. Okay, straight and then bend, especially using that quad, right? Our quad is a leg extensor. And so if we flex as we work on it, we're putting that quad on stretch, okay? You also can do some counter force. So if you want to get a little bit deeper, we're going to get on top, push here, what we call our thenar eminence, okay? So the side part of our hand bone, push that in and then bend and go up the quad. And your quad's going to attach up to your hip bone. Majority of them are, at least. So that's the direction we're going to go, all the way up to our hip bone here. It's also a little bit of a core workout because you're bracing and extending. So that's good. Motion with our massage too, okay? Hook that fascia and then pull and move the muscle. After every time we open something up with soft tissue work, we always want to strengthen and stabilize and use that muscle in this new range of motion or length or release, however you want to think about it. So with your quad, you want to do some squats, maybe some single leg raises, some knee extensions, kettlebell swings, squats or thrusters. I mean, you choose your pleasure, but make sure that you activate and use that muscle after you work on it a little bit. You don't have to get super sweaty. We don't want to pull any muscles, but try to activate and stabilize, and then stretch it out at the end. Hold that for about 60 to 90 seconds. The couch stretch is a great stretch to do for your quad. All right, so those are some of the tips and tricks of the trade. Try them out. Let me know if you have any questions. And again, we can do some Zoom or online consultations and show you some different ways for your body and your needs of how to open up the quad or around the knee, depending on what's going on with you. Stay safe and be healthy.